Aromatherapy is the use of essential oils extracted from plants for the promotion of physical and psychological well-being. It is believed by users of aromatherapy that various plant-based aromas can influence behavior, emotion, and spiritual well-being through the effects of the aromas on the olfactory senses. Although aromatherapy is often used by itself, it can also be used in conjunction with other alternative medicines or medical treatments. Aromatherapy is commonly paired with massage, and is even said to help with pain management of cancer patients and those undergoing childbirth. It has also gained popularity in individuals undergoing operations, aiding in both pre- and post-operative care. Furthermore, it is also said to relieve stress during the postpartum period, helping with depression, and in postmenopausal and elderly women. The idea of aromatherapy is an ancient technique and was used thousands of years ago in China, India, and Egypt. It plays an important part in traditional Chinese medicine. Incense was often burned for comfort. However, the use of herbs in teas was also used for physical and psychological treatment. It is shown throughout history that different forms of herbology were used amongst ancient civilizations, having both medicinal and psychological purposes. Western aromatherapy first gained popularity in 1937 following the publication of L'Aromatherapie by French chemist René Maurice Gattefossé, where he found that a burn on his hand healed quickly and with minimal scarring when exposed to lavender oil during the healing process. Despite its long history, aromatherapy is still seen as more of a beauty treatment than a method of healing. Complementary and alternative therapies have gained popularity in the last 10 years, resulting in aromatherapy to move closer towards mainstream practice in Western medicine. This increase in popularity has been attributed to the safe, uninvasive, more individualized approach towards patients, and furthermore, aromatherapy in particular is something people can do at home to improve their well-being and help with stress. It has a large amount of benefits which have been claimed by many practitioners. However, whether the measured effects of aromatherapy are placebo is a hot topic of debate in the medical community today, and something we will discuss shortly. Ornan will now discuss what the research says regarding the efficacy of aromatherapy as a complementary or alternative treatment.
There has been a lot of standardized tests and trials when discussing the efficacy of aromatherapy as a complementary or alternative medicine. With multiple applications of aromatherapy, there has been a multitude of studies to analyze its effectiveness via clinical trials. A systematic review included 12 studies with a diverse type of subjects such as pregnant women, women in menopause phase, women with children diagnosed with ADHD, healthy female volunteers, patients diagnosed with cancer, depression, anxiety, and idiopathic environmental intolerance. Discrepancy on the effectiveness of aromatherapy in both inhalation and massage was found. The mixed results could have been related to the differences in an administration protocol that diverse type of subjects included in the RCTs. In addition, caution should be taken when aromatherapy is administered by inhalation, since proper olfactory function should be confirmed before starting the trial, and the degree of the beneficial effect of aromatherapy when combined with massage should be properly studied to evaluate whether the added effect of aromatherapy is large enough to surpass the effect of massage alone. A study that showed effectiveness of the intervention involved twice the number of sessions than the massage therapy protocol of the studies with no effect of the intervention. Based on the results reported on people with cancer and psychological symptoms, aromatherapy massage is effective compared to the active control when the number of sessions is at least 8 and administered weekly. In addition, studies carried out on the effect of massage therapy in the relief of symptoms experienced by individuals with cancer showed a positive effect of massage alone, which contributed to the alleviation of the symptoms. Contrary, inhalation aromatherapy given to people with cancer showed no effect despite the high number of sessions. However, the lack of efficacy could be due to the quality of the essential oils stated in the clinical trial, claiming that one intervention group was administered with unknown purity essential oils, and the other groups were administered with a mixture of 3 pure essential oils at different concentration ratios. Another population group consisting of pregnant women carried out the study to portray the beneficial effects of inhalation aromatherapy to decrease depressive symptoms. Studied on pregnant women only used one session of inhalation aromatherapy for 5 minutes in one study. Therefore, the lack of effectiveness reported could be associated with the short intervention exposure time in the treatment groups, thus concluding that there was no sufficient evidence suggesting that aromatherapy could be used as a complementary and alternative medicine for depression and cancer care alone. However, the analysis of the clinical trials presented provided an overview of the most current evidence, deducing that aromatherapy massage showed to be more efficacious than inhalation to alleviate depressive symptoms. Pei will now go on to discuss the beliefs on how aromatherapy has an impact on how consumers live their lives.
Research into the impact of aromatherapy on consumers' lives is somewhat limited to people's perceptions and personal experiences, which means some studies can lead to biased opinions. However, extensive research has shown that aromatherapy can be highly effective in circumstances such as reducing pain and stress. There are several factors at play, such as the psychology and experience, that can determine a consumer's attitude to future use of aromatherapy, which impacts how they live their lives. Psychology refers to whether the consumer perceives the treatment to have worked or not. In a study that investigated the placebo effect aromatherapy can produce, it was interesting to note that the group that received no treatment but were informed of possible outcomes of therapy recorded the same tidal volume as the uninformed group who received the actual treatment. This demonstrates that psychological manipulation can influence a consumer's experience and thus their future use of aromatherapy as an alternative medicine. A successful experience can impact the way they live their lives in terms of incorporating aromatherapy treatment into their daily activities, as well as accounting for extra costs associated with it. On the other hand, the consumer that does not experience any benefit or relief from aromatherapy are not going to continue to use it in the future. This can impact the consumer's viewpoint on aromatherapy and other alternative medicines as well, meaning they are less likely to try other health beliefs too. In the following segment, Natalie will be discussing what complementary and integrated medicine is and how aromatherapy is used as a complementary healthcare approach.
There has been an enormous growth in the use of complementary therapies over the last 30 years. In the early 1980s, these therapies were very much considered as alternatives or even fringe medicine. In the 1990s, their rise in popularity was investigated and they were re-nicknamed as non-conventional. It was not until 2000 that the entire system was named Complementary and Alternative Medicine, or CAM. Complementary therapies incorporate strategies which are used as an addition to or an accessory for conventional healthcare. It is commonly termed integrative medicine, with the implication that the therapies will be integrated into mainstream healthcare, with complementary therapists working alongside orthodox healthcare professionals. Additionally, the term integrative implies person-centered care within the context of biomedicine. Aromatherapy is one of many therapies considered as complementary to mainstream healthcare. In its specific case, there are various methods in which it can be integrated into clinical practice. Some hospitals may pay their aromatherapists a fee for service, some may include it as part of holistic nursing care, and others may have unpaid volunteers. Possibly the most popular use of aromatherapy is in conjunction with massage. This combination is increasingly being used by health professionals such as physiotherapists to enhance normal practice. Aromatherapists claim that this has direct effects on physical structures such as muscles, joints, lymphatics, and skin. Furthermore, many doctors now accept the use of complementary therapies for patients receiving treatment for life-limiting illnesses. An example of this is the use of aromatherapy in conjunction with chemotherapy, where the purpose of the aromatherapy treatment is to boost emotional well-being and distract from the pain rather than to cure the medical condition. At the London-based day hospital, UCH Macmillan Cancer Centre, aromatherapy has been used for over 15 years. It is administered via massages and use of aroma sticks in therapy rooms and inpatient wards. In this context, essential oils are mixed to the individual's needs and applied to reduce the side effects of radiotherapy and chemotherapy. Between 2012 and 2013, the hospital provided 500 aroma sticks, and gave 1,200 aromatherapy massages to their cancer patients. Ahmed will now discuss the limitations of aromatherapy as a complement for evidence-based treatments.
Limitations. Evidence-based practice is pivotal to ensure safe and effective clinical care. Even though aromatherapy is being used by different types of health professionals in addition to conventional forms of treatment, there are a few confines that may limit its use leading into the future as a complementary means of medicine. There are a number of key factors that need to be considered when taking into account the limitations of aromatherapy when it is used as a complement. Some of these factors include chemistry, pharmaceutical approaches, controlled trials, external factors, and safety. Currently, there is significant ongoing research regarding the chemistry and medicinal properties of individual essential oils. The research studies that are present have mostly confined themselves to researching individual essential oils, as in this way the study poses no violation to medical professionals. However, following the pharmaceutical approach whereby there are no examinations of blends of essential oils, there is a suppression of the effectiveness of aromatherapy in clinical practice. This is because pharmacists tend to avoid examining the essential oils as part of a whole therapeutic event. Similar to complementary therapies, aromatherapy tends to have issues in being able to present how essential oils actually work and whether or not the use of aromatherapy elicits a placebo effect. Currently, it is known that randomized, double-blinded, controlled trials are the gold standard by which all studies should be examined. However, aromatherapy cannot be studied in this manner. This is because their effectiveness is centered on aspects that cannot be double-blinded, or in most cases, each individual patient may require a different form of treatment. In saying that, treatment application can vary from the concentration of the oils to even the method of administration. Subsequently, there are also some problems that are only specific to aromatherapy. Firstly, the chemistry of every single essential oil can vary due to external factors such as location or even weather, and as such it becomes quite hard for comparisons between studies that may have used the same oil but from different locations. Thus, due to the many limitations that aromatherapy practice poses, there may be a slight danger to the continuation of aromatherapy as part of complementary medicine. However, if in the future proper evidence arises in terms of gold standard studies, there may be use of aromatherapy not only as a complementary treatment but also as a means of medicine on its own. Below are some of the references that we use for our presentation.